Conventional cataract surgery starts the same way every single time. We measure the cornea, the length of the eye, and plug it into a formula to pick the lens power that should give you the clearest vision. Then we do surgery, place that lens implant inside the eye, and that lens implant stays with you for the rest of your life. And for most patients, that system works beautifully. About 80 to 85% of patients land right on their distance target. But that also means that 1 out of every 5 patients, we end up just slightly off. That approach to picking a lens implant for your cataract surgery is basically like buying a suit off the rack. The salesperson measures your chest, your arms, and your shoulders and says, "Hey, you're a 42 short." And 80% of the time, that suit fits perfectly well. But what if the waist is a little loose? What if the shoulders need a touch more room? Wouldn't it be better to tailor the suit so it fits you perfectly? That's exactly what the light adjustable lens does. We do the cataract surgery, place a lens, and then we tailor it. We can adjust the prescription, change the focal point, and even refine astigmatism, all after your eye heals, giving you a truly custom fit lens instead of an off-the-rack one. And that's pretty exciting. So let's jump right into it. When we plan for cataract surgery, everything revolves around one goal: Plano. Plano means that your eye has zero prescription. If you wore contacts, it'd be a 0. The closer we are to Plano, the sharper your distance vision. So how do we get to that? We measure the cornea, the length of the eye, and we use advanced formulas and algorithms to calculate the lens power. They're incredibly good, but they're still algorithms. With a monofocal lens, around 80 to 85% of patients land within a half a diopter of that target. With the king of all multifocal lens, the Alcon PanOptix, it's still similar, around 84 to 87%. But with that light adjustable lens, that accuracy climbs up to 94%. So from a pure precision standpoint, it's the most accurate lens available today. But accuracy is one thing. What you really care about is clarity. 20/20 means that you can see something at 20 feet what a normal person can see as well. For near vision, we use something a little different called a Jaeger chart, and the goal is to get to J1. J1 means that you can read fine print just like the text on your phone or prescription label. So if both eyes have had cataract surgery, here's how the lenses compare. With a monofocal standard lens, around 50 to 70% of patients see 20/20 distance, and fewer than 10% reach J1 near. With the PanOptix trifocal, around 73% of patients reach 20/20 distance, and around 50% reach J1 near. That's based on the FDA clinical trial per eye using monocular results. Now with the light adjustable lens, 92% of patients reach 20/20 distance, and between 86 and 93% of patients hit J1 near. These are for binocular results, meaning both eyes open, which is how we live our everyday life. Here's the secret sauce. That strong near vision performance with the light adjustable lens doesn't come built in like the PanOptix with the multifocal design. It comes from blended monovision, where one eye sees well for distance and the other sees slightly better for near, and then fine-tuning both afterwards. So head-to-head, the PanOptix still outperforms the light adjustable lens for near vision in a single eye. But when we use a light adjustable lens in this blended monovision approach, it can rival, if not surpass, the near vision without the glares or halos that can come with multifocals. And here's the best part. You can test drive it. With the standard monofocal lens, yes, you can do monovision as well, but once that lens is inside the eye, it's fixed. If you don't like monovision, you're stuck with it. You can always do glasses or contacts or another surgery if you have the monofocal standard lens. Now, with the light adjustable lens, we can actually simulate monovision after surgery, and you can live with it. You can test drive it. You can drive with it, read with it, scroll on your phone, and then decide. If you love it, we lock it in. And if not, we can readjust until you're happy. That's the power of light adjustable lens. It's not accuracy, it's control. Every surgeon knows the difference between 20/20 and 20 happy. You can have perfect numbers on that eye chart, and you can still feel off if that focus isn't right for you. That light adjustable lens allows us to fix that, not by guessing, but by adjusting until your vision feels exactly right. So to sum it up, if your goal is full range, meaning distance, intermediate, and near, the PanOptix is still the leader. But if you want the highest level of precision, the ability to fine-tune after surgery, and the flexibility to test drive Monovision safely, the light adjustable lens is a breakthrough. It truly is a game changer. If you found this video helpful, subscribe for more short educational videos like this. And if you're planning for cataract surgery, talk to your eye surgeon about which lens fits your lifestyle. I'm Dr. Tran. Thanks for watching, and I'll see you in the next one.